scientists and medical researchers have their own definitions of a pandemic. However, one thing is certain, that the word describes the widespread occurrence of disease, in excess of what might normally be expected in a geographical region.
If you think that COVID-19, novel coronavirus, is an extreme thing that has ever come to your world, well, you are wrong.
Today, we will be telling you about the worst 5 pandemics that have occurred in our world.
Asian flu.
Asian flu was a pandemic outbreak of influenza A of the H2N2 subtype, that originated in China in 1956 and lasted until 1958.
The World Health Organization places the final tally at approximately 2 million deaths, 69,800 of those in the US alone.
Third cholera pandemic.
Considered the most deadly of the 7 cholera pandemics, the third major outbreak of cholera in the 19th century lasted from 1852 to 1860.
It started spreading from the Ganges River Delta before tearing through Asia, Europe, North America and Africa and ending the lives of over 1 million people.
The Black Death.
From 1346 to 1353, the outbreak of the bubonic plague ravaged Europe, Africa, and Asia, with an estimated death toll between 75 and 200 million people.
Influenza flu.
The 1968 flu pandemic was caused by the H3N2 strain of the influenza A virus. It took only 17 days before outbreaks of the virus were reported in Singapore and Vietnam, and within 3 months had spread to the Philippines, India, Australia, Europe, and the United States.
HIV pandemic.
First identified in Democratic Republic of the Congo in 1976, HIV/AIDS has truly proven itself as a global pandemic, killing more than 36 million people since 1981.
Currently there are between 31 and 35 million people living with HIV, the vast majority of those are in sub-Saharan Africa, where 5% of the population is infected, roughly 21 million people.